In the laboratory, we're trying to understand why these antibodies do what they do and what we can use to refine therapeutic targets. We also try to improve detection of these antibodies in patients' blood tests or spinal fluid tests, and we try to translate this into diagnostics that can be used routinely in clinical practice. My name is Darshi Ramanathan. I'm a neurologist and a clinician scientist, and I lead the Translational Neuroimmunology group at the University of Sydney. I grew up in Thailand in the 1980s during the AIDS crisis, and I saw firsthand the transformative impact that having active immune treatments had on patients with HIV. And this really inspired my passion for immunology and understanding that research can transform lives. My father was an academic, and so I always knew that research was a big part of his career. And I became interested in neurology because I, as a teenager, read a few books by Oliver Sacks and was really interested in how the brain works and how the mind works. So I always knew I wanted to do medicine. When I did medicine, I went on to specialise in internal medicine and then went down the path of neurology, but specifically in autoimmune neurology. When I had finished my medical degree and started training as a resident doctor in medicine, that was a really exciting time in the early 2000s in the field of autoimmune neurology. A lot of new antibody-mediated neurological conditions were just being described, and there's been an explosion of research in that field over the subsequent 15 years, and that was a very big driver for my path in going down a basic science and clinical research pathway in autoimmune neurological disorders. My main research program looks at autoimmune disorders of the central nervous system, and this includes an overactive immune system which causes antibodies that react to proteins or antigenic targets within our brain, our optic nerves, our spinal cord. What this results in is patients having really devastating disability, blindness, paralysis, seizures, death in many cases. And what we now know is that a lot of these conditions were previously misdiagnosed as a viral encephalitis or multiple sclerosis, and treatments were not appropriate. Now that we know how to recognise these syndromes better, we are able to target them with immune treatments to try and reverse disability and improve outcomes. These conditions can affect previously healthy patients, children and adults, so they have a lot to lose if we don't get this right. My specific research program goes from the basic science, so in the laboratory we're trying to understand why these antibodies do what they do and what we can use to refine therapeutic targets. We also try to improve detection of these antibodies in patients' blood tests or spinal fluid tests, and we try to translate this into diagnostics that can be used routinely in clinical practice. The other clinical aspects of my research is trying to improve recognition of these conditions clinically in their scans and in patients' examinations, and try and understand how do we develop treatment guidelines so these patients are getting the best immune treatments to improve their outcomes and have the best quality of life. Our research deals largely with what we would be termed as rare disease, and as a result of that, collaboration is absolutely critical to get real answers. I lead the Australasian MOGAD study group evaluating a particular condition called myelin oligodendrocyte glycoprotein antibody-associated disease. We collaborate with 50 centres across Australia and New Zealand, and we have diagnosed almost 800 patients over the last 10 years, and this has resulted in a wonderful research resource that has enabled us to learn a lot more about this disease and its treatment. Similarly, I lead international study groups looking at autoimmune encephalitis or antibody-mediated encephalitis. So this collaborative environment is really critical. While my basic research program and clinical research program is with the University of Sydney, I recently looked at how many collaborations we have, and we're actively collaborating with 48 centres across 29 countries globally in work that we are leading. So global collaboration is really critical in our field. Our work has been funded by NHMRC, so I've had 19 continuous years of NHMRC fellowship funding. We are running the first investigator-initiated international trial on MOGAD, an antibody-mediated demyelinating condition, and that was funded by the MRFF. I've had additional research funds from the University of Sydney and the Royal Australasian College of Physicians. And I have recently been awarded a SNO Fellowship. This is an unprecedented funding opportunity over 8 years that really allows me to lead an ambitious, innovative and bold research program and support the critical members of my research team as we find real answers to many of the problems that we are grappling with. So I'm the very lucky mum of 11-year-old twins. So outside of work, my husband and I love spending time with our children, with travel and camping and beach days, and we have a really wonderful time as a family. I also very much love reading. I'm a very passionate reader, and that's a lifelong hobby for me. And I'm quite musical and really enjoy playing the piano as well.